Between 40 and 72% of people with type 2 diabetes have hearing loss, and almost none of them know their blood sugar caused it. That number comes from a meta-analysis published in November 2025, 17 studies. Nearly 8,000 people, and the conclusion was striking. Having type 2 diabetes makes you over 4 times more likely to lose your hearing compared to someone the same age without it. And if you've had diabetes for more than 10 years, that risk doubles again on top of that. The reason is the same mechanism that damages your eyes and your kidneys. High blood sugar destroys small blood vessels. The ones inside the cochlea, the tiny spiral structure in your inner ear that turns sound into nerve signals, are among the smallest blood vessels in the entire human body, and they are among the first to be damaged by chronic high glucose. But no standard diabetes checkup includes a hearing test. Nobody asks about it. You just gradually turn the television louder, lean in a little closer during conversations, start avoiding restaurants because the background noise makes it impossible to follow what anyone is saying, and you chalk it up to age. And it might partly be age. But when the risk is 4 times higher, simply because of a blood sugar problem, age stops being a satisfying explanation. That is what this video is actually about, not the signs your doctor already monitors, the ones nobody monitors, the ones you've noticed and dismissed because they didn't seem like they had anything to do with diabetes. 8 of them spread across completely different parts of your body, all connected to the same disease, and every single one is your body trying to get your attention in a language most people haven't been taught to understand. Let's start with one that surprises almost everyone: your hands. If your fingers have become stiffer over the past year or so, if one of them catches in a bent position and then snaps back with a pop, if your grip has weakened or your palms feel like they're slowly tightening inward, there is a real chance that is not arthritis. A medical review published in late 2024 found that people with diabetes have significantly higher rates of trigger finger, carpal tunnel syndrome, and a condition called Dupuytren's contracture, which is when the connective tissue in the palm gradually thickens and begins pulling the fingers into a permanent curl. The underlying cause is something called glycosylation, where excess sugar molecules in the blood bond permanently to the collagen in your tendons and joints, making the tissue stiffer and less elastic over time. This process happens slowly, over years, and it tends to affect the hands first, because the tendons there are fine, heavily used, and particularly sensitive to structural changes. The problem is that in most diabetes appointments, nobody examines your hands, nobody asks about stiffness or grip strength, and nobody connects a finger that clicks or a palm that feels tight to what your blood sugar has been doing for the last decade. People go to an orthopedic surgeon or a physiotherapist, get treated for a mechanical problem, and never find out that their blood sugar was the reason it developed in the first place. Here's another one that hides behind a completely different medical specialty: your gums. When you brush your teeth and the sink turns pink, when your gums look swollen and tender, when your breath carries a staleness that mouthwash can't seem to fix, the instinct is to book a dental appointment and move on. And you should book that appointment. But what most people never learn is that diabetes and gum disease have a two-way relationship that makes both conditions dramatically worse. People with diabetes are 3 times more likely to develop serious periodontal disease, the kind that eats away at the bone holding your teeth in place, and they are 40% more likely to have untreated cavities. High blood sugar feeds the specific bacteria that cause gum tissue to break down. At the same time, the chronic inflammation from active gum disease releases compounds directly into the bloodstream that increase insulin resistance and push blood sugar higher. so one condition fuels the other in a self-reinforcing loop. And the whole cycle accelerates in silence, because your dentist manages your teeth and your doctor manages your blood sugar, and in most cases, those two professionals never exchange a single piece of information about you. Now, let's talk about something that happens at night that people almost never connect to their diabetes. You wake up at 2 or 3 in the morning. Your shirt is damp. Your heart is pounding. You had an unusually vivid or disturbing dream, and when the alarm goes off a few hours later, you feel like you've been hit by something, exhausted in a way that a full night of sleep shouldn't produce. That pattern has a name: nocturnal hypoglycemia. It happens when blood sugar drops too low during sleep, and the body responds by flooding your system with adrenaline and cortisol to drag it back up. That emergency hormone surge is what causes the sweating, the racing heart, the nightmares, and the deep fatigue the following day. The Mayo Clinic and the Joslin Diabetes Center both flag this as one of the most consistently missed signs that diabetes management needs adjusting, because people don't think to bring up their sleep quality during an endocrinology visit. They buy a new mattress, they open a window, they accept the tiredness as a permanent part of their life. If this sounds like your nights, try checking your blood sugar right before bed, and again the moment you wake up. Do it for a week. If there's a pattern of drops during the night, that is valuable information that changes how your medication and meal timing should be managed, and it's information your doctor needs but will never have unless you bring it to them. This next one affects millions of people every single day and has been so thoroughly normalized that most don't even question it. You finish a meal, and within 20 to 30 minutes, a heavy, dragging fatigue rolls over you. Not a gentle sleepiness, but a weight that makes thinking difficult and standing up feel like an effort. You've called it a food coma your entire life. You assume everyone feels this way after lunch. They don't. What is happening in that moment is a rapid spike in blood glucose that your body cannot process efficiently. Either there isn't enough insulin being produced to handle the load, or the cells have become too resistant to respond to the insulin that is there. The result is a strange paradox where your bloodstream is saturated with energy that your cells cannot access, so your blood is full and your body is starving at the same time. That crash after eating is one of the most reliable daily signals that glucose regulation is deteriorating, and it tends to worsen so gradually that people adjust to it without realizing they've adjusted. Eating just starts to mean feeling tired, and after enough time that feels normal. It is not normal, and 2 of the simplest interventions that exist can significantly reduce it. Eating your vegetables and protein before your carbohydrates at every meal has been shown to lower the post-meal glucose spike by close to 30%. And a 10-minute walk after eating, nothing intense, just movement, blunts the peak even further. Those 2 habits alone can change how you feel every afternoon for the rest of your life. Your eyes. This one sends people to the optician when it should be sending them to their doctor. The symptom is not vision loss. It's not diabetic retinopathy. It's a prescription that never seems right. Some mornings things are blurry and by afternoon they've cleared up. You get new glasses, they work for a few weeks, and then the blur drifts back. Your optician examines your eyes, finds nothing structurally wrong, and sends you home confused. What is actually happening is that fluctuations in blood sugar are causing the lens of your eye to absorb and release fluid throughout the day, physically changing its shape. When your blood sugar is high, the lens swells. When it drops, the lens shrinks back. Your eye is being reshaped in real time by your glucose levels, and no pair of glasses can correct a lens that changes shape depending on what you ate 3 hours ago. This happens long before any permanent eye damage begins, which makes it an incredibly early warning signal, but only if someone thinks to check blood sugar instead of writing a new prescription. Your skin tells a story too, and it's one that most people misread. When a small cut takes 3 weeks to close instead of a few days, when a bruise lingers well into its second month, when a minor scrape turns red and hot instead of healing cleanly, your body's repair system is compromised at a fundamental level. About 1 in 4 people with diabetes develop significant wound healing problems because high blood sugar disrupts every single phase of the healing process. The inflammatory response that's supposed to clear debris arrives late and works poorly. The new blood vessels that are supposed to form around the wound grow slowly and incompletely. The tissue that rebuilds the skin lays down weaker, thinner, and more prone to breaking open again. Surgeons figured this out before most general practitioners did. Pre-operative diabetes screening is now routine before scheduled surgeries because slow wound healing is such a reliable marker. One endocrinologist noted that it's common for someone in their 60s going in for a joint replacement to receive a diabetes diagnosis through the pre-surgical blood work. Their body had been telling them for years, through every wound that lingered a little too long. They just didn't know that was a message. The last sign is about infections, and it connects to everything above. If urinary tract infections have started recurring, if yeast infections keep coming back regardless of treatment, if you're developing skin infections or boils that never used to be part of your life, there is a direct biochemical reason. High blood sugar creates a nutrient-rich environment where bacteria and yeast thrive. At the same time, elevated glucose impairs the function of white blood cells, the immune system's front line, making them slower to respond and less effective when they arrive. So the invaders multiply faster and the defenses work worse simultaneously. Treating each infection as it comes without addressing the blood sugar underneath is like mopping a floor while the pipe above it is still leaking. The floor will be wet again by morning. And here is the part that ties all 8 of these together, and it is the part that should have been explained to every person with type 2 diabetes the day they were diagnosed. By the time your blood sugar was high enough to trigger a diagnosis, you had already lost 40 to 50% of the insulin-producing cells in your pancreas. Those cells, called beta cells, had been dying quietly for years before a single test flagged anything, and after diagnosis they continued to decline at roughly 4 to 5% each year. The disease was never stable. It was never standing still, waiting for you to manage it. It was progressing the entire time you felt fine, and each of the signs in this video represents a part of your body that was registering the damage long before your lab work caught up. Your hands stiffening, your hearing fading, your gums bleeding, your sleep breaking apart, your energy collapsing after meals, your vision drifting, your wounds dragging, your infections returning. Every one of those is a signal that a single fasting glucose number on a lab report was never designed to capture, and every one of them is a chance to act before something irreversible takes its place. The people who do best with this disease over the long run are not the ones with perfect willpower or flawless diets. They are the ones who learned to read what their body was telling them and who learned it early enough to change the ending.